And with that, I'd like to welcome everyone to the Merge Medical Podcast. I'm your host, Dr. Jeff Brown, with my co-host, Dr. Jeff Cole. I'm very excited to welcome Dr. Keith Dressler. He is the founder and CEO of Rhinogram. This is a digital communication and virtual care solution, empowering healthcare facilities and their patients with the ability to initiate direct, HIPAA-compliant, and secure text messaging communications across the full patient journey. With that, Dr. Dressler, welcome. Thank you for joining us. Tell us about Rhinogram.
Rhinogram empowers patients and providers alike to communicate without the friction of the patient logging in or downloading an app or waiting on hold. They simply SMS, MMS text message your practice. Rhinogram's platform is fully customizable, HIPAA compliant, seamlessly integrates within all EHRs and your existing workflows, eliminating any typical industry barriers around additional cost, access, or trust to provide the best experience for both patients and providers.
Dr. Dressler, it sounds like patients are able to text directly rather than work through an app. Is that what I understand?
Yes, sir, that's exactly right. We will provide the practice with a HIPAA compliant textable number that matches the voice number they currently have.
And tell us about the need for Rhinogram.
The need for Rhinogram really came out of the patients expecting more convenience and simple ways to communicate. Real time patient initiated SMS, MMX texting shows the patients that you respect them, and therefore it's going to elevate your practice's value to them. Email is open 20% of the time. Portals have a 40% adoption rate. SMS texting has a 99% open rate and a 90% adoption rate.
That's huge. How about competition? Are they all pretty much using an app?
Most of perceived competition is app-based. There are some limited bidirectional SMS, MMS capabilities from EHRs. Rhinogram system is built to manage and handle all of the inbound text. And we were built on a patient text first, end user, innovator experience.
Excellent.
So these text communications, that they're HIPAA compliant, where are they stored? Are they stored within the EHR? Are they stored on Rhinogram, or is there some hybrid thing happening?
No, they're going to be stored in Rhinogram and or in the EHR as well. If we're bidirectionally integrated and there are certain data sets that need to come over, then obviously anything that gets pushed to the EHR will be stored there. Anything that's in Rhinogram will be stored there. And Rhinogram is ONC certified, and we are almost complete with our SOC 2 compliance as well.
How about the large EHRs? Which can you list a few that you are integrated with?
We're integrated with the most well-known brands that you can think of: Epic, Athena Health, ModMed, NextTech. There's many others. We're basically integrated with them all, and we have seamless bidirectional flow of data, which is important with all the ones that I aforementioned.
So these processes are proprietary. Are there some patents that sit behind this? Are there patents pending? What can you say about that?
Yes, we have 4 current patents, and all surrounding what I would call patient-initiated SMS, MMS texting, and how to manage and how to flow all of it is what our patents are around. We have 2 more patent pendings.
Dr. Dressler, maybe this is a good time for a few numbers. As to what you were talking about, how many employees do you have? How many patients do you have connected to the software? And then how many different specialties are you working with right now?
Right. We have roughly 25 employees at Rhinogram. We have 13.5 million patients on Rhinogram. There are 54 different medical healthcare specialties that we are servicing today with Rhinogram. That equates to 13.5 million patients.
And I guess your total addressable market would be basically everybody, the whole world.
That's right. Yeah. The market is the whole world. Our platform was built not only extremely customizable to workflows and everything else, but it was built for an enterprise healthcare system all the way down to the individual provider. There's no different system that, let's say, a health system would use than an individual provider would use. It's the same system. And we have such configurability that two docs under the same roof can actually configure it two different ways that work best for each of them. So again, this is my third healthcare IT company that I have founded, and understand very well all the nuances, the intricacies, the whatever of healthcare practices.
Can you talk a little bit about onboarding? It sounds like you would get with a clinic and you would figure out their workflow. You would figure out who the individuals are that do certain tasks, and perhaps you have a library of conversation templates. Do you serve all of that up to that?
Yes.
That client?
Yeah, Dr. Cole, thanks for asking. Yeah, everything you described is exactly what we do. We're going to, in implementation, well, the first thing we're going to do is give the practice their HIPAA-compliant, textable, SMS, MMS, textable number or numbers, depending on, again, what everything that has been decided beforehand of how this may be configured. And then we'll go through really 2 rounds of what I would term implementation to staff, where we'll have a beginning type of training, getting them used to and baby stepping them along the way, being there to handhold, and then we'll come back. I think it's a month later with a more advanced training after they've had time. We do have templated, industry-specific templates for responses to make life really easy. We don't want staff really making up whatever their responses can be. These templated responses are customizable, so you can make yourself whatever you want. They do have placeholders such as patient's first name, office location, things of that nature to personalize the responses, and again, to create real efficient workflows so that we truly take work away from the practice and give the practice back many, many hours a day of time. And then that allows them, number one, to be happy. We want the practice, and that's doctors and staff, to get off the hamster wheel and to actually enjoy and have happy, pleasant work days, and bring that back to the healthcare profession.
Do you have some statistics on call burden, the call
Sure.
center?
Yes. Call centers that use Rhinogram are going to be able to decrease inbound calls by 50 to 90%. That's inbound
amazing.
calls. Okay. Overall, they're going to see a close to 50% decrease in-call volume as an overall number, meaning that's outbound as well as inbound. So we're going to be able to decrease the overall call volume by 50%, which is massive when you're looking at the number of people needed to operate a call center.
And how do you charge an organization?
We're going to charge you based on number of annual visits. A small practice, it could be 1, 2, 3 doctors, depending on their number of visits. I think it's up to 12,000 messages a year is going to run somewhere around $349 a month, something to that nature.
Wow, that's very good. Considering you could reduce your call center staff by 50%, that's a huge ROI. And what kind of can you speak to what kind of profit margin that returns to Rhinogram?
Where we are today is we have between a 50 and 60% profit margin versus our COGS. That's where once we get to a certain number, which we're slowly getting there, and we should be there maybe by the end of the year or sometime next year, we will decrease our COGS to around 20%, which means we'll have an 80% profit margin on everything that we would sell.
Wow.
That's fantastic.
I think one more thing I'd like to touch on is Rhinogram's ability to be used as a marketing tool for a practice. How does that work?
Yes. So if you digital market, Rhinogram is integrated compliantly with Facebook and Instagram Business Messenger. So if people find you there, they can instantly begin messaging you through there, and it comes directly into Rhinogram. Rhinogram puts an F or the Instagram logo, and we know exactly where it's coming from. And when you message back, it goes directly back to the same source that you messaged in. We also provide a practice, a website widget. This is all part of our standard package. Being that they can get to you from where they live, it allows you to acquire people right from where they are, and that's going to boost your incremental business 10 to 35% based on how good your digital marketing really is.
That's fantastic. Yeah.
I think this is so cool. And again, I want to thank both of you from the bottom of my heart for the ability to get in with you guys and help everyone. I think you guys will help Rhinogram. Hopefully Rhinogram will help you guys and make it really the place to be for innovative and rewarding and change really the landscape of healthcare, which is really what I wanted Rhinogram to do and to change really the entire communication paradigm to a more modernized communication platform.
That's fantastic.
Yeah.
The whole purpose of the podcast, the Merge Medical podcast, is to showcase healthcare related disruptive technologies. And this is clearly it. So I want to thank you, Dr. Dressler, for joining us.
Yeah.
I'm Dr. Jeff Brown with my co-host, Dr. Jeff Cole. Thank you.